Yeah, what in the world did you bury here? What is that? Ooh, yeah. You know, it's really one of the only healthcare professions where most of the world is illness care. We wait for a motor to blow up forward. And you mentioned earlier, you know, I don't really have much, and I have some tightness in my back. I'm a runner. And it's sort of the same reason we check our alignment of our tires in our car. We don't wait for our tires to wear out unevenly. We don't wait for our motor to smoke before we change the oil. And so in the same way, we kind of know in the spine where most surgery happens. And one of the ways I sort of begin chiropractic for a lot of people is I bring up the fact that there are 24 vertebrae in here, you know, 24 segments in the spine, and I ask how many of them with a lot of frequency have a lot of surgery. And most people will usually say kind of everywhere, but the reality is that the lower neck and the lower back encapsulate about 99% of surgery. And there's a structure called discs that are little spacers that are non-sensitive. We can't feel them, and so when we injure them, we don't perceive it. And so that's part of the difficulty of the spine, that only half the spine has feeling. And the common medical and chiropractic explanation for why we have disc injury, which then results in nerve pressure because the disc can hit the nerve. So pain comes from that disc hitting the nerve, and the reason for disc injury, they'll say, is because of age and weight. You know, they'll say it's wear and tear. It's a wear and tear of your back that's causing that disc to get injured. And I go, well, how old are the other vertebrae? Right? It's pretty silly explanation to say that it's aging that's causing disc injury when I have 19-year-old girls that are 120 pounds with disc injuries, right? So it doesn't make any sense to say that it's aging, and I have people that are much older with relatively no disc injuries. It's the alignment and mobility of your spine. And I think about most of the things that we do in our life, we're not better at them with a flexible chest, right? You're a better bench presser, for instance.
Yeah.
You're not bench pressing like this. Our world encourages chest rigidity, and that's actually the reason for why this area gets so chewed up.
And he's sitting right now. We're all sitting.
We're all locking our chests. And so that's all I do in here. I come in here and I go through the spine like a piano, and we check and see if all of them are working. Typically, the parts that don't move don't feel much until we push on them. And so you'll say, oh my gosh, what the heck is that? Well, it's part of your back that wasn't moving, and as a result, another part is going to have to eat it.
Right.
As a result. So our world gives cortisone shots and painkillers, and we, avoid a problem until it gets so insurmountable that now we have to do something more invasive. And so tell me what's going on. With all that said, right shoulder pain, tell me about that.
Yeah, so really, if you were to take areas that, are tight all the time, it would be like in the middle of your back, like right along that scapula there, where, you have probably a lot of people that say the same thing, but that's just really tight, and then a little bit more on the right side. So however I'm looking at my phone or typing or whatever I'm doing, it just feels like those repetitive motions are putting pressure there.
One of the things we distinguish is, sometimes we call this, what you're referring to is this area in here, right? This is, with the shoulder, there's a difference between shoulder, your glenohumeral joint, and the border of the scapula, all these rhomboids, and then really the ribs, and then also the referral pain. So the lower neck joints, when they're in distress, right behind Angela there, she's got a poster behind her that describes the referral pain. So when these joints are in pain, they'll give you pain down here. And so it's really a lower neck issue that gives us that in between the shoulder blade pain. And so and then generally it's another part of the spine that's the cause. So if this part of my neck is tight, my neck will tilt away from it, and then we grind this because we're in avoidance of this. Let me straight forward. And then about a ½ inch. So the head, the ear hole, called the external auditory meatus, should be over the center of your acromion from the side. Actually, there's a plumb line all the way down. So your lateral, this malleolus should be over your ear hole. Do you understand?
Yeah.
It goes all the way down to the ankle. And so even plantar fasciitis, knee pain, hip pain, your head has to be over our heels, essentially, our ankles. And so the more forward, or the amount of time we spend forwardly rotated, we never really retract. We maintain some of that forward rotation. And so a lot of what we do in here is what we call mirror image work. If your head's forward, we take it to the back. If your head's to the left, we make it to the right, and we balance. Just turn your head left for me.
Turn your head up.
Any pain when you turn left?
No. Just on no.
Okay, turn your right for me. Any discomfort? Okay. And then just look up for me. You're a little stiff, yeah. And then look down for me. Anything going on?
No,
Okay.
just on the very edges, it being like, it almost, I can hear it be crunchy almost.
All right. So again, we don't get to choose. I ask you for your range of motion, and you don't get to like ask your vertebrae to move, right? They either move or they don't move.
Right.
It's not a conscious, it's not something I can train you, like start moving more with your atlas.
Yeah.
It's not how it works. Your spine's a volunteer system. So when you're rotating, the textbook normal is 80 degrees. So you should have 80 to 80. 90 would be all, laterally, but 80 to 80, so 160 total. You're showing me roughly, I would say probably like 70, maybe a little bit less to your left.
Mhm.
Your total range of motion is less. And ultimately, most of it should happen from the upper neck. So there are 7 vertebrae in the neck, but each vertebrae doesn't give an equal amount.
Mhm.
Certain vertebrae give more. And the top 2, called the atlas and axis, give a predominant most of the range of motion. So that's what we're going to work on to restore that, and we'll check it at the end.
Okay.
So one of the reasons why it's important to have the upper neck moving is that if the upper neck is tight, the lower neck has to do extra. And again, like I said, you don't have a choice, or you can't choose to where your spine bends.
Right.
Okay. So that's where chiropractic can essentially balance your mobility. Bend the neck, bend the knees for me. Sorry, there we go.
Oh.
Yes, sir. Take a deep breath in, little sit up, I'm gonna help you. Head back, exhale. Keep going, keep going. All right, deep breath in, I got you. Head back, exhale. There you go, let it go. A little tight there, yeah. One more. Exhale. Yeah, okay. Get the idea?
Yeah.
Right? You have some mobility here.
Uh-huh.
These two, the second and third one I did,
Yeah.
Now they moved a little bit. They didn't move enough to hear a click,
Mhm.
and that's actually not the purpose of my adjustment, is to see how many pops I can get out of your back.
That gets clicks on YouTube.
As much as I want to hear the sounds,
Right, yeah.
that's really not what I'm after. I'm not
Yeah.
trying to have a pop counter of your back.
Right.
What I want is your spine to feel soft.
Yeah.
Whether it pops or not really isn't super relevant.
Mhm.
It didn't feel soft. It felt like I was pushing on something hard.
Right.
Right? And so if your chest is stiff, that area essentially is going to stay in a time capsule. It's not going to age.
Mhm.
Take an x-ray, an MRI of you, and it looks the same as it did when you were 18. And the medical world and most of the chiropractic world will call it unremarkable that part of your spine didn't age. And I find that to be tragic.
Mhm.
Because if you can't explain why that area didn't age, you'll never understand why this area got
Right.
injured.
Right.
Right? That non-functioning area is the cause.
Yeah.
Your chest stiffness is the reason why your lower neck will be in
Yeah,
distress at
yeah.
some point.
Right.
And everybody wants to inject
Yeah.
and strengthen
Yeah.
and do something to the injured area when it's your chest that's the problem.
Mhm.
And so we're going to beat it up in a second.
All right. Okay.
I got you. Uh-huh. There's a little bit. Yep. Good. Breathe. I got you. Exhale. Yeah, real tight. If you notice when I'm putting my hand on your back, I'm placing it up here,
Yeah.
and I'm adjusting this, but I didn't touch your lower back.
Mhm.
We went SI joint and middle back.
Okay.
There's differences, and you might, chiropractors love to put their hand on the lower back and adjust this guy.
Mhm.
All surgery happens here. Leave this alone, work above and below. All right, deep breath, exhale. There we go, it moved, yep, good, okay. Breathe, so middle back's talking to me. That's me. That's so stiff. And my shoulder went. On your back for me. Yeah. There's that. This is why you can't turn your head left. This bump right here. Feel that bump right there?
Yeah, I do.
I can't even feel your right atlas. So the top bone has these large wings on it.
Mhm.
Right? So where are you feeling it? See these large wings
Yeah.
on that top bone? If everybody,
Mhm.
almost like now that I showed everybody, like, oh my gosh, you're right there. Giant wings on them.
Right.
We can't. The only part of the atlas you can feel. This is tucked up underneath your skull, so you can't really feel what we call the posterior arch.
Mhm.
All you can, now there's some chiropractors that say they can feel it, and I go, anyway, I don't think you're feeling the posterior arch there, buddy. You might be feeling some tissue above it, but we can feel the wing, okay?
Yeah.
And so what I'm feeling is when you tilt your head to the right, the bone actually slides to the left. So your head is straight with your torso, but the bone is sticking way out to the left, as if your head was tilted to the right when your head's not tilted to the right. Catch me?
Yeah.
So you're going to grind that right lower, you're in essentially right tilt, which is popping this bone out, and then you're going to grind this guy because we're in avoidance of an injury on your left upper.
Okay.
That's your diagnosis. That's the alignment.
Yeah.
Well, your head is straight on your torso,
Mm-hmm.
and I can feel you there. Look at that, man. It feels like a little pencil eraser for everybody's home.
Mhm.
It feels like a pencil eraser under the skin. Real easy to feel his left atlas. I can't feel it. It's sunken in. Now, if I tilt you, hold on. Yeah, there he is. I have to tilt him to the left to actually feel his right atlas. The alignment determines the stress levels, determines the aging, which ones age at a faster rate. If you only chewed food on the right side of your mouth, the teeth on that side would age faster than the ones on the other side, right?
Right.
So it's not a belief system. This isn't a religion. I'm asking you to take a leap of faith with me.
Mhm.
You should accept Jesus. Anyway, but just, oh my gosh, he was talking to me about Jesus the whole time too. Anyway, all right,
Enjoying the call.
back to this is a physics. We call this chiropractic biophysics. Okay, there's a physics to your spine. Physics is a quantification of what we observe, right? If you ask enough questions in physics, eventually you get to it's just the way it is, right? We don't.
Mhm.
If you drop an object off a building, it will fall at 9.8 meters per second up to terminal velocity. Well, why? Well, it's based on the density of the Earth and the bending of fabric of space-time,
Mhm.
right? Why is that? Well, I don't know. It's just the way it is. You understand? Eventually, so there's a physics to your spine. It doesn't really answer why. It just answers it is. This is the way it is, whether you like it or not. I got you. Everybody walks out. Easy, easy. Everybody leaves the office. Okay, easy, easy. Come on. Yeah. Wow. He moved, but wow. Easy, easy. Let's go. Let's go. We'll get better. The goal is to not see how many pops I can get out of your neck. Again, I'm trying to adjust one area and not adjust another area, right? It isn't good if we manipulate every segment because we didn't balance anything, right? Even though it made a cool everything. It's like, well, you just loosen what's stiff and you loosen what's loose, right?
Mhm.
Not the best, you know. It's like Jenga. Any 2-year-old can knock the Jenga tower over. The skill of Jenga is to move one piece, and that's what an adjustment differentiates between an adjustment and a manipulation. I've seen too many thousands of pictures. They all start looking like the movie Groundhog Day with Bill Murray. It's the same day. I'm looking at the same X-ray in many people, and everybody's acting like it's unique, and it's not unique. We're all in the same wear patterns.
Mhm.
Oh, look at that, another C5, 6, and 7 disc injury, another C5 bone spur. Yeah, when am I going to see a C2 bone spur?
Right.
It doesn't exist. This area locks down, the lower neck has to do extra as a result. Look how smooth this side feels. I mean, jeez, it's like a totally
Yeah.
different neck over here.
Hmm.
It is smooth. Feel the difference? I mean, it's
Yeah, I
just
do.
absolutely butter over here. This is the abused side, the side that functions, right? This is the side that's
Mhm.
doing. That's why I don't have any problem with it. It's already moving.
Mhm.
What do I do? Make it move more? It's already moving.
Mhm. Right.
What do I need to adjust it more? No, you need to leave it alone. And so you're going to see me, Ed, I feel like you spent way too much time rubbing the left side of the neck and you almost ignored the right side. Yes, correct. I'm done with it almost. It doesn't need more time than this. I'm going back. Your care should almost be a few weeks just working on this to level the drawer. The drawer is open and it's crooked. I'm not going to push the side that's already in more in. I'm going to level it first and then we take them evenly. So when I look at his back, this is all elevated. He's relaxed face down right now, but the right side of your back is more elevated than the left side.
Mhm.
So that generally means this is more what we call subluxated, and maybe a word you've heard chiropractors use meaning sub, meaning less than, luxated meaning dislocated, so less than a dislocation. The bones aren't dislocated, but they're crooked. It's popped up over here relative to this side. Because this is more subluxated, it also is going to be stiffer. And so because it's stiffer and out of alignment, this has to eat it because this is not working properly. You know, if you get a massage, it should be at least 2 to 1, like 10 minutes here, 5 minutes here, kind of thing, or at least maybe 3 to 1 time spent until it levels out. Once it levels out, then you can go even.
Mhm.
But it's going to be predominantly, this is not good over here.
Mhm.
All this. Okay. There we go. There we go. Muscles get tight for generally one of 2 reasons. One, they're guarding something.
Mhm.
Okay. So if we have an injury, our muscles will come to the aid and protect, or posture, right? So if your head's forward, the muscles in your neck are tight because your head's not on straight. Okay. All right. Yeah, there it is. There's something you buried. Jumanji. Yeah, you buried something in there. Little dents and things. I'm not saying it's perfect, but this side's at least talking to me. The other side's got its arm folded and its back towards me. not even looking at me. This is actually, it's got some suppleness to it. It's got some motion. The piano keys are going up and down.
Scared yet, Angela?
No.
Oh, good. I'm not scary. My father's scary, though. Meet my father one day. I grew up chiropractor's kid, right? So, I thought everybody got chiropractic care.
Yeah, I was gonna say.
I thought everybody was getting adjusted. Then I realized, oh no, I'm the only. It's just me. I'm just gonna keep going back to this thing. Not too bad until right here. This will auto level with the stretchings that I'm going to show you later. It's like rolling dough out with a roller, right? The dough that's higher will get more pressure on it. Now you're going to feel crooked on it when you're not crooked, because your back's crooked. So as your back levels, it'll feel more natural and won't feel awkward. But we're going to put you on some stretching in a minute. I'll show you how to do this. And Ed, am I on this thing straight? You are, but your back's not level. So it's going to feel like one side's getting more pressure, and it is. And then as you master the stretching, it will feel more level. And that's ultimately the only way to change posture. Chiropractors taught and still teach that adjustments change posture permanently. Yes, temporarily there can be a subtle change, but ultimately our alignment is determined by the ligaments that wrap our spine. And those ligaments have to be stretched. The adjustment is necessary to make the spine malleable enough to actually be stretchable. And when we stretch, the areas that need to be stretching are stretching, not just the loose ones, right? So we're actually stretching in a balanced fashion. So you need, otherwise I would just sell the stretches. Why even do all this table work if stretching is what changes posture? You can't put lay people on stretches. You have to be prepped. You can't polish a dirty car. You have to clean it first, then you can polish it. My usual joke is it costs double if you want me to be quiet. Yeah, what in the world did you bury here? What is that?
You always wonder if you're just like everybody else, or it's like
No.
worse than normal.
This didn't exist on this side. If you notice this?
Yeah.
What is this? wine stain that you put a couch over. That's what this is. That's an injury that your body said, no, just ignore it. All right. So the purpose of that side posture adjustment was to loosen this joint. We're targeting the sacroiliac joint, what we call the SI joint. Probably not an area that you typically ever feel until you touched it.
That's right.
It's so stiff in here. I don't feel much of anything in there, Ed. Right, and that's not good. We need to be having this guy talk and have a conversation with him a little bit. Let's see what we're dealing with here. So inside, wherever there's lactic acid, which is a cellular byproduct, when your body creates energy, lactic acid is the result. And so when an area is stiff for a long period of time, it's been injured, guarded, or even posture, lactic acid will accumulate and stay trapped in an area. That acid, surprise, surprise, is not something a nerve likes. Nerves don't like sitting in acid. And so if you make a nerve sit in acid, well, it's going to fire pretty easily. And so this is why something will hurt even if you're not moving. I'm laying down and my back still hurts. That's inflammation. We call it inflammation if you want, but it's just the nerve, the tissue is dirty. The entire purpose of breathing oxygen is to convert that lactic acid to carbon dioxide and water. And oxygen does that conversion. Okay. Ooh, yeah. Get the idea, right? Coercion. Why did that bone move now? Well, took down some of the self-defenses. I got you. Right, you can feel that right here? That guy here.
Yeah. It's almost like I can feel like I'm pushing back against you without really trying, like it's
Okay,
protecting. Yeah.
They're right there on that left. Okay. It's like climbing a ladder. Every visit we get more and more mobility. And leave that lower neck alone and work on this upper back.
I do have this left foot pain,
Okay.
a little bit that I've been dealing with that I normally don't. It's just like a pulled tendon in the right side of my right foot, but it's very recent. I didn't even put it on.
Right side of your right foot?
Sorry, on the left side of my left foot. I'm sorry.
Left side of your left foot, like on the outside of the foot here?
Yeah, like right
In
here.
Sure. Okay.
Yeah.
It's moving. Good. Let me see again. Pretty tender in there?
Right there.
Yeah.
Yeah, right there.
This generally happens because we're walking on the outside of our foot.
Yeah.
Okay? The weight of your body should go calcaneus to in between your big toe and your second toe. That's where the weight should transfer to. You shouldn't even be accessing this area. This area is, and so as a result, this area of the bones will grow here, right? Because there's extra stress. And so the answer isn't to try to manipulate this and do something to it. The work should be going to get the weight back where it belongs, which is over here. Generally, we don't walk properly here because the fascia is being pulled on, because this muscle is too tight, our arch is dropping, and then there's pain here, and so our body compensates. So we're going to work here. Saying all that, that's why I wrote the shit. Why am I rubbing my shit? I told you my foot. The tendon of this muscle is what controls the arch of your foot. And so if this, right in here, gets out of hand, essentially the fascia starts getting upset and then the body compensates. Right there. It's called tibialis anterior, and the tendon of this muscle is what supports the arch in the foot. And so the tighter this muscle gets, the more the arch drops. Stress on the inside of the foot, compensation. Now the outside of his foot's killing him. Okay. Cause effect. Right in here. This usually gets tight because, again, forward rotation, head's forward. It's like, daggone, it's on my neck. It's always the neck. Right? Feel that? Good. Kind of good. Okay, go ahead and press back. There you go. Almost there, yeah. Almost, okay. Go ahead and tilt your head left for me a little bit. Tilt left. Uh-huh.
Oh my gosh.
Go ahead and tilt your head left. Uh-huh. Not convincing Angela on this one. She might not. Okay.
Yeah,
you ain't
yeah.
touching my ears, bud. All right, go ahead and tilt right. Uh-huh.
It feels
I
good.
didn't know those would crack.
Yeah.
We're making a certain area bend, not another area bending. We're forcing the bending to occur here. That makes sense?
Mhm.
Instead of allowing just L5 to bend, I
Yeah.
want the bending occurring as a team. Okay. Very good. Yeah. Now, one thing you can do is you can have your head turned left a little bit to work on that left atlas that we talked about and get a little bit more pressure on that left side. You don't have to do that, but we want to level the drawer and then go level in.
Mhm.
So you could do a little bit of rotation left for about a month, prescription kind of idea, until that levels out a little better.
Mhm.
Main thing is to not be on that right side. Try to get your head back and left. Slowly turn your head left for me. Yeah, yeah. How does that feel?
Pretty good.
Turn your head right for me. Yeah. Then look up for me. Yeah. Yep, it looks good. All right.
All right.
You're great.
Thanks a lot.
Yes,